Good morning, everyone, and thank you for joining the webinar. My name is Robin Watts, and I am the HEDIS Project Manager for the Colorectal Cancer Screening Measure. I would like to provide some clarification on the information above. HEDIS 2023 is the reporting year when the data is collected and reported, and the measurement year includes the time frame when the service is rendered. This varies for specific measures. For the colorectal cancer screening measure, it can be up to 10 years prior, and we will review this in the following slides. Today, we will be discussing description of measure in eligible population, appropriate types of screenings, ways to meet compliance, reports versus medical record documentation, exclusions for the measure, tips for meeting compliance, and Mercy Care support and efforts to increase compliance. Eligible population for HEDIS 2023. This includes the percentage of adults aged 45 to 75 years of age as of 12/31/2022 who had appropriate screening for colorectal cancer. Please note the age range has been revised this year to 45 to 75 years of age from the previous 50 to 75 years. Colorectal screenings can be completed by having a procedure or ordering a lab test. Screenings typically start at age 45 and continue to age 75. Compliant procedures include colonoscopy, with this test being done normally every 10 years. Flexible sigmoidoscopy, this test is usually done every 5 years. CT colonography, this test is usually done every 5 years. And then we have compliant lab, which includes the stool DNA with a FIT test. One example of this is a Cologuard. This tests stool for hemoglobin and abnormal cells. This test is usually done every 3 years. The fecal occult blood test, we have a guaiac FOBT or the IFOBT, fecal immunochemical test, which tests for hemoglobin in the stool. This test is usually done every 12 months. Of note, the lab stool DNA with FIT test is different from the IFOBT or the FIT or the GFOBT. We will discuss this in detail on the following slides. Additional compliance includes a pathology report. Pathology report that indicates the type of screening, for example, colonoscopy or a flexible sigmoidoscopy, and the date when the screening was performed meets criteria. For pathology reports that do not indicate the type of screening and for incomplete procedures, then we would look at evidence that the scope advanced beyond the splenic flexure that would meet criteria for completed colonoscopy, evidence that the scope advanced into the sigmoid colon would meet criteria for completed flexible sigmoidoscopy. Documentation in the medical record. Colonoscopy during the measurement year or the 9 years prior to the measurement year is compliant. So we are looking at January 2013 through December 2022. Documentation for colonoscopy can be located within office visit notes, progress notes, medical history, health maintenance section, preventive care section, procedure report from a gastroenterologist, as well as a pathology report. If you have a questionnaire form that the patient completes about having a colonoscopy, or it's mentioned in your progress note or medical history that the patient stated they had the screening done, this is considered patient reported and is compliant if the type of screening and the date completed, which can be the year or the month and year, is available. Documentation in the medical record. Flexible sigmoidoscopy during the measurement year or the 4 years prior to the measurement year is compliant. We are looking at January 2018 through December 2022. Documentation for a flexible sigmoidoscopy can be located in the following locations: office visit notes, progress notes, medical history, health maintenance section, preventive care section, procedure report from a gastroenterologist, as well as a pathology report. If you have a questionnaire form that asks your patients about having a flexible sigmoidoscopy, or it's mentioned in your progress notes or medical history that the patient stated they had the screening done, this is considered patient-reported and is compliant if the type of screening and the date completed is available. Again, that can be year or month and year. CT colonography during the measurement year or the 4 years prior to the measurement year is also compliant. We are looking at January 2018 through December 2022. Documentation for CT colonography can be located within office visit notes, progress notes, medical history, health maintenance section, preventive care section, as well as radiology reports. If you have a questionnaire form that asks your patient about having a CT colonography in the past, or it's mentioned in your progress note or medical history that the patient stated that they had the screening done, this is considered patient-reported and is compliant. Again, if the type of screening and the date is completed. Again, it must be a year or month and year. Now we will discuss the lab test for compliance screening. Stool DNA with FIT test, or fecal immunochemical testing, during the measurement year or the 2 years prior to the measurement year is compliant. For the stool DNA with FIT test, we are looking at the dates of January 2020 through December 2022. Documentation for stool DNA with FIT test can be located within lab reports, office visit notes, progress notes, medical history, health maintenance section, as well as preventive care section. If you have a questionnaire form that asks your patients about having a stool DNA with FIT test, or it is mentioned in your progress note or medical history that the patient stated that they had the screening done, this is considered patient-reported and is compliant if the type of screening and the date of completion can be year or month and year is available. On documentation in the medical record, what we have next is the fecal occult blood test during the measurement year 2022. Documentation for an FOBT can be located in the lab report, in office visit notes, progress notes, medical history, health maintenance section, and preventive care section. Again, if you have a questionnaire form that the patient has stated that they have had an FOBT screening done, or it's mentioned in your progress note or medical history that the patient stated they had the screening done, this is considered patient-reported and is compliant if the type of screening and the date is available. The immunochemical fecal occult blood test tests the globin or the protein portion of the hemoglobin, so one sample is required. The GFOBT tests the hem or the non-protein, making it non-specific to human hemoglobin portion of the blood, and therefore 3 samples required. So documentation must state a GFOBT is completed or that 3 samples were completed and the date of completion. New to the 2020 measurement year was a required exclusion of palliative care anytime during the measurement year. Documentation of an assessment, palliative scale, an admit or clinical note, outpatient, inpatient daycare, or mention of medication for this type of care meets compliance for exclusion during the 2022 measurement year. Here are some chart tips for compliance. The age range for colorectal cancer screening is now 45 to 75 years of age. Please offer screenings to all that are non-compliant. If a patient declines an invasive screening, offer a least invasive method. For example, a colonoscopy is declined, then offer the stool DNA with FIT test or an IFOBT. Make a follow-up call if the member is non-compliant after receiving an order for a colorectal cancer screening. Be sure not to document C-scope, as this does not meet compliance. C-scope can be cystoscope, so this would be unclear. And the last bullet here, always remember to document the type of screening and the date. We received several notes or medical history stating colorectal cancer screening 2014. If this is a colonoscopy, it is compliant. If it is any other test, it is not. But it doesn't state which specific test, so we couldn't use that for compliance. Same goes for documenting colonoscopy up to date or UTD. We need to have at least the year of completion to meet compliance. Examples of documentation and tips. Colorectal cancer screening due 2024 is non-compliant. If it's unclear what type of colorectal cancer screening was last performed and the date in which it was last performed, this will be non-compliant. This example doesn't state the type of screening and the date it was completed. Flexible sigmoid completed 2019 is compliant documentation. Please document the date and type of the last colorectal cancer screening in a place easily accessible. Ensure that you're aware of when the next one is due, but always provide the completion date. This is the only date we can use. We can't use a due date for compliancy. If you do not have access or have been unsuccessful in obtaining past completed colorectal cancer screenings, document what the patient tells you regarding their last colorectal screening. This is considered patient reported and is compliant. Patient states never had colonoscopy and refuses. That is non-compliant. Having a discussion with the member does not meet compliance. They must do a screening and be up to date on this. Offer a non-invasive type of screening and follow up on completion. Colorectal cancer screening ordered 1/3/2022 is non-compliant. Ordering a colorectal cancer screening does not meet compliance. The screening must be ordered and completed using the type of procedure and the date result of screening. The lab will clarify that it was completed. FOBT completed 1/3/2022 and result negative would be compliant documentation. If you ask your patient to fill out a questionnaire, be sure to contain a question asking about the patient's last colorectal cancer screening. Be specific, ask the date and the screening type. Colon cancer screening 2018 is non-compliant as the type of screening is not provided here. Colonoscopy and date completed 2018 would be compliant documentation. Ensure the questionnaire is placed in the member's medical records so the provider is aware when the next one is due. We are here to help. For our Mercy Care Advantage members, we are offering a $30 gift card for any colorectal cancer screening completed by December 31st of 2022. On an annual basis beginning in June, Mercy Care outreaches members to encourage them to complete colorectal cancer screening, utilizing a FIT kit at home whenever possible. This outreach includes member educational brochure about colorectal cancer and screening options, coordination with Sonora Quest Laboratories to utilize the SQL ordering portal and FOBT program. This concludes the presentation on colorectal cancer screenings. I want to thank you for all that you do each and every day. Please feel free to contact me if you have any questions or further needs in the future. My information is provided here. Thank you again and have a great day.